Khalid Alqadi earned his medical degree at the King Abdul Aziz University Medical School in Jeddah and worked as a doctor in the kingdom. But for the last 3 years, he has been specializing in neurology here at George Washington University Medical School in Washington, D.C. Dr. Alqadi says the training he is getting here is the best in the world.
We have access to everything through the library. We have the access to go to the best conferences every year. And I think the goal to go back and trying to build a really good residency and help people over there as well.
He says here in America, he and his Saudi colleagues are working with the most advanced medical technology and learning cutting-edge practices like transplants and regenerative medicine. He says he also values the modern and friendly approach of his professors.
Most of the attending or supervising physicians are, laid back actually and try to help you to get the best of your training, as well as, the approach is a little bit different. They want you to have your own decision, and they will ask you, what do you think, and what's the next step, stuff like this. Dr.
Alqadi is part of a huge surge in medical personnel going to the United States for advanced training. They now number more than 2,400. The majority are doctors and dentists. There are also current or future nurses, pharmacists, physical therapists, and others. The number more than tripled in just the last 2 years, according to Dr. Samar Alsaggaf, a former dean of the women's campus of King Abdul Aziz University in Jeddah, who now directs the advanced training from the Saudi Arabian Cultural Mission outside Washington, D.C.
We have an expansion in the health system and also in the higher educations. We almost in 5 years now, there's more than 24 universities, more than 5 big medical cities, a lot of budget this year, and in the last 5 years is giving to the maybe a third of the budget is going to the health system and to the higher educations. And this will explain that we will have a lot of medical cities, a lot of hospitals coming with the medical colleges as a teaching hospital, and all of these needs human resources.
The Saudi health professionals have their education and their living expenses paid for by the King Abdullah Scholarship Program, or sometimes by the university or government ministry where they work. 1/3 of the Saudi trainees are women. Dr. Samar says this big investment is expected to pay off by rocketing the Saudi health system into the 21st century.
Because this is all what we hope from our future doctors. They will be our future leaders in the health system. And my ultimate goal for me and for them, I usually tell them, you will go back and you have to make some change. I heard from some of them that they want to go back with and to set a local program that is very high standard, that everybody in the world will look to train in Saudi Arabia.
The exchange program has so far placed Saudi health professionals in over 100 leading universities and teaching hospitals in America. The health professionals are already in great demand and are being hired by universities and hospitals in the kingdom even before they finish their stints in the United States. Earlier, most Saudi doctors, dentists, and nurses went for advanced training to Canada or Europe. But all that changed 5 years ago with Riyadh's decision to strengthen ties with the United States and greatly increase the number of Saudi medical personnel coming here to America for training. Burton Bolag, KSA2, Washington.